Hello, I'm Sheila Dodds, Acting Auditor General of British Columbia. Thank you for joining me. As you know, we've presented our latest report to the Legislative Assembly entitled Child Care Licensing Capacity. Before starting, I wanted to acknowledge with respect that we conduct our work on the Coast Salish territories, primarily the Lekwungen People's traditional lands, now known as Victoria. Today's report is the product of great work by our audit team. They are Laura Pierce, Lisa Sevigny, Julianne King, and Emily Benoit, and my thanks to all of you. I also want to thank the staff of the Ministry of Education and Childcare and Vancouver Coastal Health for their cooperation during our 2 audits. And I want to acknowledge the many childcare providers and early childhood educators who do such tremendous things for kids and their families. I'll give you a summary of today's report, and then I'll be happy to answer any questions about it. In 2018, the provincial government launched its Child Care BC plan, the 10-year strategy to create more access to affordable, quality childcare services. Child Care BC includes a commitment to, quote, increase capacity in health authorities to license new spaces, conduct investigations, and monitor compliance. This capacity commitment is at the center of the 2 audits we're reporting on now. Our first audit looked at whether the Ministry of Education and Childcare worked effectively with the Ministry of Health and the 5 health authorities to implement the capacity commitment. We wanted to see how the Ministry of Education and Childcare worked with health partners to implement the commitment to increase the capacity in health authorities to license, monitor, and investigate childcare facilities. We also audited Vancouver Coastal Health to see how it has planned for childcare facility licensing capacity, especially given the Child Care BC plan to increase childcare spaces. I'll go through the 2 audit reports separately, starting with the audit of the Ministry of Education and Childcare. The ministry is responsible for childcare planning and funding. However, the licensing of childcare facilities falls to the Ministry of Health and the 5 regional health authorities. It's a structure that is unlike any other jurisdiction in Canada, and it requires effective coordination and partnerships between ministries and health authorities. So, what did we find? We found that the Ministry of Education and Childcare had not worked effectively with its health partners to see that childcare licensing capacity had increased to support the growth of childcare spaces. The ministry did not have a documented set of expectations. It had not defined roles and responsibilities. It had not established timelines and targets. It wasn't clear how funding to implement the capacity commitment would be secured or how funding needs would be identified. And the ministry didn't monitor and report publicly on the implementation of the commitment to enhance the capacity of health authorities to license, monitor, and investigate childcare facilities. As a result, we found that the Ministry of Education and Childcare did not know whether health authorities had increased their capacity to license, monitor, and investigate childcare facilities in BC. The importance of licensing capacity is driven home when you consider that 39,000 new childcare spaces have been funded in BC since 2018. The target is to add a total of 70,000 spaces in the province by 2028. And as I mentioned, today's report includes 2 separate audits. Now I'll move on to our second audit. The second audit looked at Vancouver Coastal Health, which is one of 5 regional health authorities responsible for licensing childcare facilities. We chose to look at Vancouver Coastal because it serves a large population, has a significant number of childcare facilities, and includes urban and rural communities. We wanted to see if Vancouver Coastal had assessed its capacity to license, monitor, and investigate childcare facilities, especially considering the rising number of childcare spaces. We found that Vancouver Coastal did not adequately assess its capacity to license, investigate, and monitor childcare facilities. Key performance indicators, or KPIs, and timelines can help an organization understand what it wants to achieve and the staff it needs to be successful. We found that Vancouver Coastal tracked and largely met a KPI for childcare site inspections, but it didn't have indicators or timelines for its licensing and investigation activities. It also didn't track the time staff spent on these activities or how long it took to approve new licenses or complete investigations. This information is key to determining whether Vancouver Coastal has the appropriate number of staff required to meet growing demand. Vancouver Coastal last received funding for new child care licensing staff in 2019, but since then, the number of child care facilities has increased by 19%. Through these two audits, we found that better coordination between the Ministry of Education and Childcare and its health partners would help ensure that health authorities keep up with the growth of childcare spaces and maintain the quality of licensed childcare. Each of our audits included 5 recommendations, and I'm happy to say that they have been accepted. With that, I'll turn it over to our moderator and welcome your questions.
Thank you, Acting Auditor General. We are going to begin the Q&A portion of today's event. Media on the phone line, you may queue up to ask a question by pressing *1. For media in the room, please raise your hand and introduce yourself and your outlet when it's your time to go. We ask that you limit your questions to 1 question and a follow-up, and we're going to start in the room today.
Hi, Andrew McLeod from the TIE. You mentioned in your opening remarks that our system of licensing is unlike any other province here. What do other places do? Like, are there other models for this that we should be looking at?
The model in BC is unique in that the responsibility delivery of the child care plan is with the Ministry of Education and Childcare, and the licensing as part of the residential licensing system that resides with health authorities. I can't speak to what models are elsewhere, but as we said in the audit, the key thing is, with the model, it's important that there be good coordination between the 2 ministries.
Just in plain language, like, what does this mean for families who have children in care? You know, should they be concerned that there aren't inspections at the level that there should be? You know, what does it mean for parents who are putting their children into care?
The audit really highlights the importance of ensuring that there's capacity to maintain that frequency of inspections, to have the capacity to license in a timely manner, and to be able to monitor compliance with the requirements of the legislation. I think for parents, the audit did not look at what was happening on the ground, but you will see in the report for Vancouver Coastal that they do have a KPI for doing regular inspections, and they're basically meeting their KPI. So I would say it's not a worry, but it's something that's really important. And as we've said in the report, it's important for the ministries and the health authorities to understand whether they have the capacity needed to meet their own expectations to deliver that oversight of the quality of care and the safety of children. And as I said, all of the recommendations that were made have been accepted.
And we are going to switch to the phone line right now. Ashley Joannou, Canadian Press, please go ahead.
Hi, thank you. Andrew asked my question, but I am curious whether you guys did any sort of number crunching to figure out just how short of staffing some of these health authorities are. Like, I know you said in the report that staffing numbers have stayed the same since 2019, but the number of facilities has increased 19%. Did you do that broadly for the province, and do we have a sense of like how many more people they would actually need?
Thank you for that question. It's a really important issue to understand whether the health authorities have the capacity to meet the expectations for the child care licensing. And in the first of the 2 audit reports, you'll see that what we've identified is that the Ministry of Education needs to work with their health partners to set expectations on what the level of licensing should be, the timelines, so that they can actually look to determine what that staffing complement should be.
Ashley, did you have a follow-up?
I don't. Thank you very much.
And we have no further questions in the queue. If you'd like to arrange a phone or video interview with the Acting Auditor General, please call 250. Oh, actually, we will actually go to a call on the line here. Travis Prasad, Global BC. Go ahead.
Hi, thanks for this. I'm just wondering if there will be plans for the Auditor General to follow up on the recommendations and perhaps do another audit or another report down the road. Is there a timeline for that?
Thank you very much for that question. We actually have an annual follow-up process where we follow up on all of the recommendations from our performance audit reports, and we discuss that follow-up report with the Select Standing Committee on Public Accounts. So the recommendations, the 10 recommendations from these 2 audits, will feed into that follow-up process. And I believe that the next follow-up report will be in the fall of 2025. But we will be paying attention, and we will be meeting with the Select Standing Committee on Public Accounts.
Travis, did you have a follow-up?
Yeah, I guess so. Sorry. I guess in terms of this audit, were there any signs of the ministry or Coastal Health, implementing anything that was, highlighted in previous audits? Then was there any progress made on that front, or was it kind of the same?
This is our first audit looking at the licensing of childcare facilities. So I guess our report really is tied into the Childcare BC plan that was initiated in 2018, a 10-year plan. And what we focused on with both of the audits was looking at the commitment in that plan to ensure that health authorities would have the capacity to support the growth in childcare spaces, licensed childcare spaces.
And now we have no further questions in the queue. If you would like to arrange a phone or video interview with the Auditor General, please call 250-419-6117 or email communications@bcauditor.com to book a time. You can also visit oag.bc.ca for more information. I want to thank everyone for coming today. This concludes today's media availability from the Office of the Auditor General of BC.